Should I choose Raloxifene for long-term osteoporosis management? Imagine a medication that can help strengthen your bones and also lower your risk of certain cancers. Raloxifene is a drug called a selective estrogen receptor modulator, or SERM, used mainly by postmenopausal women to manage osteoporosis. It works by mimicking estrogen's positive effects on bones, helping to increase bone mineral density and reduce bone breakdown. This makes it a good option for women who want to avoid hormone therapy or cannot take estrogen. Research shows that Raloxifene can cut the risk of new vertebral fractures by about 30 to 50% after 3 years of use. That's a significant benefit, comparable to other common osteoporosis drugs called bisphosphonates. However, its effect on preventing hip fractures or other non-vertebral fractures is less clear and generally not considered as strong. It does increase bone density in the spine, hips, and overall body by around 2%, which contributes to its fracture prevention ability, but bone density is just one part of the picture. Beyond bones, Raloxifene has some extra perks. It lowers LDL cholesterol levels by about 10%, which might help with heart health. It also reduces the risk of invasive breast cancer by roughly 76%, making it appealing for women concerned about breast cancer risk in addition to osteoporosis. Safety is always important. Raloxifene does not stimulate the lining of the uterus, so it doesn't increase the risk of uterine cancer like some other hormone treatments. Common side effects include hot flashes and leg cramps, but serious issues are rare. Still, it can raise the risk of blood clots, so women with a history of blood clots or high risk for blood clots should discuss this with their doctor before starting. Studies up to 5 years show that Raloxifene's benefits in strengthening bones and reducing fractures last as long as you take it. If you stop, bone density and fracture protection may decline, so ongoing treatment is usually recommended. It can also be used after stopping other osteoporosis medications like bisphosphonates to help keep bones strong. Raloxifene is especially suitable for postmenopausal women with osteoporosis or severe osteopenia who also want to lower breast cancer risk or cannot tolerate other treatments like bisphosphonates. However, it's less effective at preventing hip fractures, so women at high risk for those might need different options. Always remember, choosing the right treatment depends on your individual health profile, fracture risk, and personal preferences. Ultimately, Raloxifene can be a good long-term choice for some women, offering fracture risk reduction, modest improvements in bone density, and added benefits like breast cancer risk reduction. But it's essential to discuss your specific situation with a healthcare professional. They can help determine if this medication fits your overall health plan and ensure you're making the safest, most effective choice for your bone health.